Hello, everyone, and welcome to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual neurolinguistic programming and cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one session in both French or English, and also do group settings. If you need any assistance, reach out to DMB Therapy and Coaching Services at 301-325-1550, and our website can be found on lifecoach.drdanpodcast.com. Today, I'm very excited to have for our first episode of season 22 a very special guest, an author and psychiatric nurse, Kay Hancock. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Kay, the floor is yours.
Well, thank you so much for having me today. It's really an honor to be here. Um, yep, like I said, I've worked in the field of mental health for my entire career. Loved every moment of it. Really, it's very challenging. But I've always called my day job my side hustle. I've been a writer also my entire career. I'm also a wife and a mom, raised four children, and have a big bunch of grandchildren as well.
Okay.
Um, but I love, just generally love people. And I think working in psychiatry has taught me a great deal of just love and understanding of people. And I think what you probably know as a psychologist, that when there's a mental illness in a family, you have a mentally ill family, and
Mhm.
everyone deals with that. And you sort of love to see a family thrive and learn how to deal with this person rather than reject this person. And I have loved to have been part of that process, working in my field. In the latter part of my career, I worked in managed care,
Mhm.
so trying to coordinate care for individuals and their families, coordinating that kind of thing. But for a long time, I worked in the hospital with patients, and also in the field of addiction. It's all kind of um, uh, connected.
Mhm.
And I did a lot of work with patients that suffered from bipolar disorder. And a lot of times, bipolar disorder and addiction go hand in hand, or it can. And it can be quite complicated, quite hard to diagnose.
Yeah.
So, anyway, so as a result of that, um, I I wrote a book called Dancing on Broken Glass. That was my first book, and that has a main character. Mickey is my hero, and he suffers from bipolar disorder. He's married to a girl that has a history of cancer. So it's called Dancing on Broken Glass because it's a story of their marriage, which, of course, they're dealing with a very stressful situation with her diagnosis and his diagnosis. So
Well,
anyway,
first, thank you so much for being here. I mean, mental
sure.
health has always been my passion, so I kind of like commend you and all the work that you've done helping people dealing with bipolar disorders and other mental illnesses. And as you know, Kay, prior to the pandemic, it feels like there was a stigma attached to mental health, where people were too afraid to disclose their mental health status to family, friend, or coworkers because of that stigma, because of thinking that they're going to have two guys with a straitjacket coming in and taking them to the next asylum that's really close by. So people were afraid. But then when the pandemic happened, it appears to me that a lot of people changed their perspective to mental health, or mental illness actually. And now it seems to be more accepted in our society. And because of that, I think the last Census Bureau, in this terms of statistic, they said that there's somewhat between 19 to 26% of the population dealing with mental illness or some form of mental illness, which kind of like we're talking close to what, 86 million people. That's a lot, and we don't have enough therapists out there to be able to cater to the demand. And that's what
Isn't that
people
the
now, yeah, they have to wait a year before they could see a therapist. So I feel that more and more people like us that are there to be able to help others who are dealing with this struggle. And also, there's what we call the self-care, especially when it comes to families that are dealing with a family member that has mental health problem. So they're also suffering, and they cannot really know how to be able to cope with those issues. So, what is your stake in terms of mental health post-pandemic?
Well, I'm so sorry. That's what I found as well. I think that the pandemic really did a number on everyone. It was difficult and forcing people inside, forcing people to actually be by themselves and with their family, and forcing us to live in a way we had never lived before, made us acknowledge that we had issues. I'm so sorry.
No worries.
But at that time, I was working in managed care, and we had enormous need of people calling in. Our crisis lines were on fire, and people were just struggling to talk to someone, struggling to vent, struggling to say, is this normal for me to feel this way? And it opened my eyes so tremendously to the need for us to be there for each other. Not it yes, we needed therapists. Yes, we needed professionals. But it was also in the middle of the night when I was working, and I was just, yes, I'm a psychiatric nurse, but sometimes it was people that just simply needed a human voice, someone, a kindness. And so it also opened my eyes to the very specific need that we have for people to become therapists and professionals in this very, very significant area. But it opened up compassion almost, because a lot of people acknowledged, I'm going through this, and that means maybe you're going through this. And then they were talking to each other a little bit. And I think it helped people sort of relate to each other in a way that, am I mentally ill or am I just struggling? And if I'm just struggling, then maybe I can just be kinder, because somebody else might really be struggling more than me and having an actual mental health crisis. And so in a way, the pandemic helped us, the way I see it, grow in our humanity.
Okay.
It was a very difficult time, but if there's a silver lining, I think it helped people reach out to people in the best way we could.
Okay.
I saw that.
Excellent. Now, it is true that just recently, the American Psychological Association, they mentioned something about a new type of or new spectrum of bipolar. There was usually bipolar 1, and now there's bipolar 2 disorder. If you could tell our listeners the differentiation between those two diagnoses, what makes one different from the other?
Well, I think my understanding is the severity.
Okay.
So bipolar bipolar 1 is, if I understand it correctly, mania and psychosis. It's a spectrum. And so mania and psychosis and out of control emotions are at this one end. And the very, very rapid cycling of bipolar, the severity of it is one bipolar. The other is mood disordered, the depression and the lack of just being able to be stable in your mood, but still functional. And so, like everything, there is a continuum. And when you're in a manic stage and you cannot be responsible for yourself, that's one thing. When you're in a mood over here that you can still get up and go to work, you can still support your family, you can still kind of put one foot in front of the other and function, but you don't feel great, that's another spectrum. So there's a separation. Now, when you get at this other end, when you're kind of out of control and you're kind of, this is where people make allowances for themselves. I like that feeling of mania. I have a lot of energy. I want to use that energy. And so I'm going to be hypersexual. I'm going to spend a lot of money. I'm going to make poor decisions because I feel invincible. It's that kind of thing. You're really wound up. And as opposed to over here, I just don't feel right. And so like with bipolar, there's several variations. And somewhere in the middle there, a doctor will make a diagnosis of bipolar 1 or bipolar 2. And then there's just different medications. The thing that I find with these diagnoses is there may be other factors involved. And also, we can't eliminate the need for understanding a person's core characteristics. And because you can be a very, very significant bipolar, but be under control. One of the very, very best books that I've ever read on bipolar is called An Unquiet Mind by Kay Redford Jemison. And
yours.
do you know her?
No, I've heard of her. Yes, I did.
Yes. And she's a doctor. She's a psychiatrist, and she was out. She talks about her journey and being completely psychotic out in a parking lot, and knowing that she was out of control, having enough insight into her behaviors, knowing that she could not live this way, and knowing that she had to get control of this. The thing about bipolar is you want to feel that good. You want to feel that energy. You want to be that productive, but there's a fine line. So with her, she talks about this journey of knowing that she had to be on a medication that kept her stable. Well, that stable in her life was boring. And that's the thing that sometimes people that suffer from this disorder don't want to give up, that mania or that feeling of energy to stay stable and boring. But she made the decision to do that so she could advance in her practice and her career. She knew that was the price that she had to pay to stay out of psychosis, to stay out of danger. And so that's what she did. She stayed on medication. To me, that's what it takes. I'm very pro responsibility. I think mental health, when you suffer from mental health, it's like suffering from any other illness. Diabetes, cancer, lupus, anything, you have to treat it. And when you treat it, you can function in many, many cases. Not always. Some things get the better of you. But in many cases, if you go to therapy and you treat it and you find the right cocktail of medications to treat your symptoms, you can live a life that you can function in. And
so is it comparable to Asperger's syndrome for autism, and those who are stage 4 and are completely lost inside their world? I mean, when it comes to bipolar, as you mentioned, so for example, if let's say we have to treat ADHD, the doctor will give Adderall, for example, just to be able to focus. Is there a way to be able to provide them with this hyperactivity that they have, what they thrive, what they want to achieve with bipolar disorder, but yet at the same time keep them calm? Or they're going to counteract each other?
Well, it happens sometimes with bipolar disorder. Very, very frequently, it's not diagnosed until somebody gets very, very depressed.
Okay.
And they finally go into the doctor and say, I'm so depressed. And I used to be so happy. I used to be so productive. I used to have all this energy. And then a doctor will put them on an antidepressant, something like fluoxetine, Prozac, or something like that. And sometimes an antidepressant will push them into mania. And then a doctor will say, oh my goodness, this doesn't look like regular depression. This looks like cycling. This looks like, and so then sometimes a savvy person that's struggling with mood disorders like this says, oh, I know how to tweak this. And this is what my character did in Dancing on Broken Glass. He wanted to find that fine line where he could function and still have a little energy. And so that's not uncommon. People kind of find what works for them in their chemistry, and kind of stay on top of the boring line and not fall below the depression. And when people start self-medicating, they get in trouble. And so either they they fall into depression, which is a hole, or they tweak a little bit and then they fly. And so it's a very difficult diagnosis to treat if you don't have compliance on the patient's part. And the patient requires a lot of trust in their clinician. so, so what you're asking is something they should discuss in therapy. Can you find a medication that will help me not feel so low, still have enough energy to get through my day and to think creatively, be like a normal person that gets up in the morning, and I don't mean normal, but like a person that functions on their own to be creative and function and have the energy they need. Can we find that? And then they experiment with all the kinds of medications that are out there that apply to the chemistry of a certain person. But that takes time and patience. And so many people that struggle with mental illness don't have that patience, and they give up,
Yeah.
and they say, I'm done with this, and I'm going to go to the streets and I'm going to try this, or alcohol makes me feel better than this crap.
Yes.
And so, they're self-defeating, and it becomes a very difficult cycle.
Mhm.
And I don't envy the person that's struggling with that. And it's why with people with bipolar disorder or any mental illness, they tend to rely on other things to help them feel better.
You see, that remind me actually, okay, of a case. Actually, it's my own uncle who dealt with hyperthyroidism, and then they had to really give him radiation to bring back down the thyroid level. But then they made him hypo. So there's never really a good, accurate way to give medication to bring a good level. So what happens then at this point, Kay, where it's like for someone going through chemotherapy, you will kill all the good cells and the bad cells in the body. So your immune system is compromised. So you could never really accurately know what are the bad cells to be able to kill them with the procedure, the process of chemotherapy. So how do you do this with mental illness? Is there a way for the doctors or technology, whatever it is, to accurately pinpoint how much dosage should they get or give to the patient to bring to the level that the body needs to function properly?
Well, unfortunately, the only way to know that is by the mood of the patient and their behaviors. And with antidepressants and mood stabilizers and those kind of things, it takes time for that to build up to a therapeutic level in the blood. And it's not an overnight fix. It's not something you can take and feel better within an hour, which is what we all want, right? We want immediate
Instant
gratification.
gratification, yes.
And so when
Human nature.
and when I've got a headache, I want to take something and I want the headache gone today, right now, in half an hour. But with mental illness, you sit down and you take a medication, and they say you'll see a difference within 6 weeks. Ooh, I don't want to wait 6 weeks. I can't stand how this feels right now. And the other thing is your family or your loved ones or the people that are around you all the time are going to see a difference before you do. And so listen to them. And this is all not very good news to the patient. They want to see something much sooner. And so again, it's establishing that trust with your clinician. And sometimes people end up in the hospital, and they're there for a week, or insurance companies, they don't like them there very long.
Mhm.
They're there to stabilize initially, and then so you try medication for a little while, a few weeks, and see if things are lifting. Are you sleeping better? Is your appetite returning? Have you done anything have you let go of some habits? Have you been craving alcohol? Have you been have you overspent? What are some of the things you were doing 6 weeks ago that you're not doing now? Are you seeing an improvement? Well, yeah, I'm not doing that and that and that, but I don't feel any different. But the wife says, oh, he's so much nicer. He hasn't bit my head off, you know, it, uh, and so, it's that kind of thing that the measurements are different than than what maybe the patient might report.
Okay.
And so then you say, okay, so these are some improvements maybe you haven't noticed. And so it's very, very gradual, or it can be. And some things that in that you might measure immediately, it is a level of anxiety. And you can take something for anxiety that will kick in rather quickly. But as far as mood stabilizers go, or general lifting of depression and lowering of mania, those take a little bit more time. Stabilizing of mood takes a little bit more time. You have to be more patient with that. And so when you ask a question like, is there something you can do? it's it's establishing a trusting bond with your clinician and having the patience to see it through, and regular therapy. It usually, the best treatment is medication and therapy, and you're kind of in it for the long haul. You can't go in and say, I've got cancer. Can you fix me up by next Tuesday because I've got a dance I need to go to?
Yes.
It's it you're in it for the long haul, because it's not an easy fix, but it it can be treated. Most illnesses can be treated, but we are a society that likes things right now.
Yeah, absolutely. But then when you have a combination of more than one mental illness, and you have suicide intent, and you have the depression that usually come together, then you have the anxiety that follows with chronic depression, and so on and so forth. Um, is there, I mean, it's kind of like a tidal wave of issues coming your way. How do you dissect each and every one and know how to treat each and every illness independently, but then they all come together at one, and then they all disappear all at once? Well, not
Right.
disappear, they all manage in the right way.
Yeah. Right. Well, what you're describing is probably a pretty good mental health crisis when they hit all at once. And that's probably when someone might end up in a crisis unit, or in the emergency room, or in the hospital, and need to be, monitored closely until they're through that tidal wave, and maintain. The goal there is to maintain their safety.
Mhm.
And once you feel like they're maintained, or through that crisis, then you move them to a safe environment, hopefully families, hopefully somebody that can care for them, and get them through. And then you've got them connected to somebody, a good therapist, a good support system, that can sort of see them through the time period that it's going to take to stabilize them with medication, therapy, good support system. If there's substance abuse on top of that, that's got to be taken care of, detox, maybe, whatever. um, you do have to untangle what's all going on, and sometimes it all hits at once. um, if it's the breakup of a relationship, on top of, okay, now I'm just going to get drunk, on top of, I've lost my job, on top of, a manic episode. You're right, that's a tidal wave of everything that's got to be untangled and dealt with. But sometimes the best place to do that is in a safe environment.
Is it more common for bipolar to have self-destructive mentality, where they feel that everything comes together and they just want to end it or cut
Well,
themselves or whatever it is? So is it
habit it.
attached, you like attached to each other in terms of, okay, well, if someone is slashing their wrist or cutting, whatever it is, would you assume that this may be related to bipolar?
Oh, absolutely. If that's their diagnosis, I mean, it can happen with depression, it can happen with schizophrenia, it can happen with anything. But if they have a diagnosis of bipolar, in the story that I wrote, his wife is very, very ill, and they're never supposed to have babies because of their diagnoses, and then miraculously she's pregnant, and he wants her to have an abortion, and she doesn't want to. And so he's so desperately afraid he's going to lose her, uh, because she won't have this abortion. So he is, in his mind, he's just spiraling, and he's sort of self-medicating to stay on top, but that messes up his chemistry. And so that's exactly what happens, is he becomes very self-destructive. And that's exactly what you're describing is what happens. He's afraid, he's anxious, and he's self-destructive. So it becomes this tidal wave,
Mhm.
and he ends up
So out of
in the
all the mental illnesses out there, Kay, why the book Dancing in Broken Glass focus primarily in bipolar? Why that specific illness?
Well, it's kind of a funny story. I set out to write a book about these three sisters,
Okay.
and she ends up pregnant when she shouldn't because she had this husband. But I wanted I want it in the end. Okay, so I don't want to give too much away, but I wanted a character that I could show that he was so much more than his diagnosis. So Mickey, of course, he has these problems, but he's so much more. And I believe that mentally ill people, like all people, are so much more than their diagnosis.
Mhm.
They're so much more worthy than their diagnosis. And and that in the end, Lucy chose him because she fell madly in love with him and saw all of this potential. And and their marriage survived because they had a contract that he would do his best to manage his bipolar. She wasn't going to be a mother to him. That's number one. And that he promised if he was going to take her on as a wife, that he would manage his bipolar. So in the end, tragedy strikes, and but he ends up with this baby. And I've been criticized by that because they thought some of the reviews that I've gotten were, really, but but he manages his illness, and he has a great support system, and he ends up with this baby because his wife suffers from cancer.
Mhm.
So in the end, I needed an illness that I believed could be managed. And I needed a character that I believed in. And I have met patients like this. I have met and know people that manage their illness enough to survive in this world. And and not just survive, but thrive. And and I believe that of everyone. I think just like your journey, like your wonderful podcast, we are more than we appear to be, and we're stronger and more resilient than than whatever's wrong with us and whatever our challenges are.
Yes, absolutely. So where can people, before we conclude the podcast, where can people find your book?
Oh, Amazon, Barnes and Noble. I have a website, khancock.com. And yeah, so and I've read a couple other books, and they're all about worthiness. That was the bottom line: is Mickey was worthy. I think we're all worthy.
Yes, absolutely. Well, I mean, just I'd like to appreciate, first of all, you sharing this incredible story. But on that note, that is all the time that we have for today's podcast. I really appreciate you taking the time out of your busy schedule to join us. And thank you again for participating and inspiring our many listeners with your incredible story. Now, we hope that you've all enjoyed today's episode. I'm also very excited about the many upcoming guests that we have scheduled for season 22 of the Happiness Journey podcast, filled with inspirational stories, just like the one that you listened today. Now, here are some concluding words of wisdom. Navigating the highs and lows of bipolar disorder is a profound journey of courage and resilience. Remember, every wave, whether it lifts you skyward or pulls you down, also brings invaluable lessons and strength. You are not alone in this. Surround yourself with those who understand and support your unique path. Embrace your experience as part of a larger, beautiful mosaic that is uniquely yours. Hold on to hope, for it is both the anchor and the compass in every changing tide of your life. Your resilience is powerful. Your journey is inspiring. My name is Dr. Dan Amzallag, and you may all keep pursuing your amazing journey in life.